Thank you, Madam Chair, and I'm going to get some help in a minute from Karen Riddell with my report. But first, what I want to highlight is the fact that the hospital just completed accreditation just over a week ago. We have the preliminary draft results. We do not get the final results for approximately another week. As soon as we get them, we will share them with everyone, with the staff and the community. I just want to take this opportunity to say thanks to the board of directors and all of the frontline staff for their participation in the accreditation process. As you know, it happens every 4 years, and there are certain standards, over 2,000 of them, that a hospital like ourselves is judged against, that to see if we meet those standards. And then they have what's called also required operational practices that we have that are mandatory, that you must meet in order to be accredited. So we will get the final results very shortly. But again, I just want to thank the board, the employees, professional staff, our volunteers, our patient and family representatives. They did proud. And I think the comments in the report, when it's eventually the final report, when it's eventually released, will reflect how proud we are of them and each other, and how proud they are of the staff and the work that they do. So I look forward to getting that. We'll probably talk about that in June. So next part of my report that I'm going to hand off to Karen Riddell is just an update on some of the various health human resources investments or initiatives that have been in place now, going on like almost their 5th year. So I'll pass it over to Karen to explain what they all are. We've updated these previously, and she'll give up-to-date numbers. Karen?
Thanks, David, and good evening, everyone. I'll hit the highlights of a number of programs that we have in place, including the Enhanced Extern Program, Supervised Practice Experience Partnership, and Preceptorship Program. And these are all investments that have been supported in the provincial budget that David will talk about a little bit later. So the Extern Program reimburses Ontario hospitals for the cost of employing externs and extern mentor coordinators. This started as a COVID-19 related health and human resource relief for the challenges that were being experienced, and it's been continued on. Really leverages the clinical service delivery expertise of the participating hospitals, and it gives us the flexibility to identify how they are being incorporated to best support the workflow and patient management. So we've had great success with this program, both from partnership with our schools, as well as enhancing the student experience and also the transition of practice. Since the start of this program, we've hired on average about 215 externs annually, and we have close to 230 externs working at Windsor Regional Hospital currently. So it's been very, very successful. The Community Commitment Program for nurses is utilized to attract registered nurses, registered practical nurses, and nurse practitioners to work in the hospitals, long-term care homes, and community care agencies, primary care, mental health, and addiction agencies that are in the greatest need across Ontario. So this program provides $25,000 in grant funding to eligible nurses in exchange for a 2-year commitment to an eligible employer. So to date, we've been able to hire over 250 nurses using this program. So another great success story. Our Supervised Practice Experience Partnership is a program that's in partnership with the College of Nurses of Ontario, Ontario Health, and then College of Nurses of Ontario approved organizations, which we are one. The program offers applicants the option to complete a supervised practice experience in Ontario. And there is a video that can be found linked in the attachment with this overall presentation. Since this program started, we have placed 65 individuals, allowing them to complete their practice experience, and we've hired 18. So just a small number of programs that we've implemented that have really helped us from an HHR strategy perspective at Windsor Regional. I'll hand it back to you, David.
Thanks, Karen. And as Karen stated, these have been in place. We were talking about them today as the extern program, the third and fourth year nursing students has been in place now. This is its fifth year running. So it is an amazing program that allows students to get that experience for the third and fourth year of their schooling, and at the same time develop relationships and friendships. So when it comes to filling vacant positions or available positions, it really works out well. The students want to be here when they graduate, and we want them here. So it's been very positive, and needless to say, then the orientation process is that much smoother because they've worked with us for a couple of years. So before they graduate, so beyond positive programs that now are embedded in the provincial budget starting in 2024. We also, this past month, had a great opportunity to celebrate the fact that we got back to zero harm. For those of you who might not remember, for years now, going back even before 2013, we would track what we call a harm index for preventable falls with injuries, hospital-acquired infections, and irreplaceable specimens. And even the accreditors commented on this, the fact that they hear about reducing harm, but they do not hear about a hospital setting a target of zero. So unfortunately, the data indicates that approximately 8 to 10% of the patients that attend any hospital in the world are harmed by that hospital. They're not helped, harmed in the sense of getting a fall with injury that's preventable, a hospital-acquired infection, or there's an irreplaceable specimen that gets lost in the process. So we went on this journey over a decade ago to say zero is achievable, and telling a patient that, oh, you were one patient was harmed out of the thousands we saw this particular week is no solace to that patient, because to them it's 100%. It's not one of some big denominator number. So aiming for zero is the goal, is the target, and throughout the years we were hitting that. And hitting it definitely frequently before COVID hit. And once COVID hit, we started to struggle, of course, hitting that again. Now that hopefully we're on the other side of the serious waves of the pandemic, we can get back to this. We still tracked it, but we can get back to it and get back to zero. So it was a great celebration. And every time we get to zero, we celebrate both campuses, regardless of which campus it's at. All the staff participate in the celebration because it does take a lot of work, and it's not just from nurses and doctors. It's housekeeping, food and nutrition, infection control, porters. I can go on and on with respect to how many people are involved in ensuring patients are not harmed when they come to the hospital. The other thing in my report is a highlight of the provincial budget is it states that hospitals will get a 4% base increase or to hospital healthcare. We won't get those exact numbers till July, August. Whether it's that high, most likely it's not. We'll have to see. It's dependent upon multiple factors, but we'll see when we get that. And again, it'll take a little bit of time for that. As stated by Karen, in the provincial budget, the programs she had outlined were identified and continued. So that's very positive. And now, as she stated, the nursing extern is actually embedded in the budget. It's not an annual thing. It's there now permanently, which is fantastic. And again, we'll get those letters July, August, a little bit later. Then I highlight in the report the workplace wellness program. Again, it was something that was highlighted during accreditation as well. and it just shows a snapshot of the numbers of individuals that have participated in it. The board just supported a renewal for 2 more years with respect to it, which is great. It's not only for our frontline staff, but it's for their immediate family. A lot of activities sell out, and we try to double book them, triple book them, and book more. And then we continually evolve to highlight those that really the staff really enjoy. So very positive with respect to the results too. You can see the surveys that are done regarding the feedback involving them. Then this past week, we celebrated our years of service at the organization amongst all of our staff. The professional staff has an event in June that they're going to do this, so the employees. And we celebrate 5, 10, 20, and as high as 45 years for some individuals. So that's great. Also, I highlight that May 5th marks Red Dress Day across Canada. It's a day to remember and honor missing and murdered Indigenous women, girls, and 2SLGBTQIAX peoples. Displays are up at both our Met and Elect campuses, as well as our Cancer Center, honoring the spirits of those taken too soon. Next week is National Nurses Week. May 6th through 12th. I outline in the report the multiple activities we will be having for Nurses Week and all the various activities, and the celebration and the awards are listed there. So it's quite exciting. We brought back the Met mobile convenience carts, at both Met and Elect campus, and they're to provide families a little bit of comfort that they need. So that's great news. Another step to getting back to normal. And then highlight the activity with the new acute care hospital. A lot of stuff going on in that regard, a lot of positive things. Again, it is to be tendered in 2025, shovel in the ground in 2026. You will, if you drive by 42 and 9, there is a lot of activity going on at 42 and 9. The Lafferty, I'll use the name Lafferty corn stand at the corner, that gravel lot will be actually increased because we need access for parking for the various activities that are going on and the staff that are working on the property. There was a question whether they said, well, could we close a Lafferty corn stand and just use that spot for our parking? And I said, I'm not the one closing Lafferty corn stand. So we had to expand the gravel lot, and I'll be underway shortly to expand that. So Lafferty corn stand will still be there for those listening in the general public as normal. And trust me, I will never be the individual that stops Lafferty corn stand at that gravel lot. And as we plan for the new hospital, we are segregating that area for a civic area left to be seen what it's going to contain. So pretty exciting stuff. This report goes back to the good old days when I used to do the report based upon our strategic directions of the organization and highlight under each of the strategic directions. I haven't done this for a year. And before that, I hadn't done it for a year, and I hadn't done it for a year. So hopefully this is not one and done. And I can continue doing this in this format, outlining all the various programs under the strategic directions of the organization. So, Madam Chair, that's my report, and thanks to Karen Riddell. And I don't know if there's any questions or comments.